Today on my show, I'll be having a conversation with Brant Herman, CEO of MouthWatch. MouthWatch is one of the first teledentistry companies that hit the scene a number of years ago, and they continue to work on a lot of innovations in the industry. So I'm really excited to have Brant on my show today. Welcome, Brant.
Hey, thanks for having me, Mike.
So, Brant, you and I have talked a lot in the past, and the whole idea of obviously teledentistry became, quote, popular with COVID, even though it's been around a long time. People use the triage emergencies and all the COVID related things. But you and I have had a lot of conversations about, hey, where's this going? When COVID ends, teledentistry has a definite place in dentistry. And so talk to me a little bit about kind of moving forward, some of the benefits to patients, to practices, groups, and DSOs, and kind of where you see teledentistry's places as we move into a post-COVID world.
Yeah, great point, Mike. So, during COVID, and especially in the initial period, we saw a lot of practices utilizing it as potentially a stopgap measure, right? A way to just communicate with a patient if there was an emergency, if they had to evaluate something to determine if they should come into the office. But I think with our deep roots in teledentistry and really seeing how it was used pre-COVID, and I think a lot of the adoption and acceleration that's happened as practices have reopened and utilized it, there's some really exciting ways that practices, programs, groups are going to start being able to expand the use of teledentistry to where it's more than, let's say, one specific use case that they're implementing, right, for the virtual consult over video conferencing. But it becomes a part of a bigger workflow and really connects their practice to a range of opportunities to enhance care.
Right. So that's a good point. Every day I hear from listeners, people that I work with, groups and DSOs that I help. And when they talk about teledentistry, they're going, hey, Mike, you know what? We want to look at teledentistry vendors. And I go, okay, why do you want to look at them? Well, we want to do these video consults. They're becoming really popular. But just as you're pointing out, there's much more to it. So let's take it past the video consult. That's kind of old hat by now, right? In both telehealth and teledentistry. And I'll tell you what, you know my background being in medicine and dentistry, and I know your interest in medicine. Let's talk a little bit about collaboration, because to me, myself, having worked with interoperability of patient records for years in different disciplines, I'm excited about the ability to do case collaboration with teledentistry, both within dentistry and then medical dental. So talk to me a little bit about your knowledge of that, where you think you're going with that, because I think that's an exciting area.
Yeah, so I think the starting point for a lot of general dentists on that is think of their current network of specialists that they refer to. It might look like a business card. It might look like a practice calling an office and letting them know they're going to send a patient over or to try to book an appointment for them. To us, what that can look like with teledentistry is perhaps while the patient's in the chair, if you need that specialty consult, they can talk to the patient, they can meet the patient, they can see in a real video or captured data some intraoral conditions, the need for treatment, and really do that initial consultation with the patient while they're still at the GP's office. So what's nice there is you've got this now kind of pyramid of connectivity where the GP and the patient who have trust now bring that trust transfer over to the specialist during that consult. Any clinical files, any scans, any radiographs, any health history, that's all shared to the specialist, and it's available and really saves that patient time so that they can perhaps get right into treatment or at least save the consultation visit. And it keeps the originating GP in the loop on care and post-op and everything that's happening. They're able to be updated a lot more easily and frequently. I think
so talk to me, I just want to jump in. So talk to me a little bit about that, because I do know, this whole feedback loop between GP and specialist, people get lost in the shuffle, records get lost in the shuffle. Somebody sends their patient to a specialist, they don't hear back what's going on. So can you focus in on that kind of closed loop, that electronic system that allows that loop to be complete, so patients don't get lost, records don't get lost? I think that's really important.
Yeah, I think one key part of it is it gives that GP visibility on it, right? It also streamlines the process for the specialty office. So instead of knowing that this dentist sends stuff in one way and this dentist sends stuff another way and this dentist sends stuff, or I have to have an online account to this HIPAA compliant email and this file sharing system, it really streamlines it. So we see a lot of specialists owning the Teledent account and inviting their GPs to it to really make it easy for the GPs to refer to the specialist. Same thing goes for a dental lab. If I want to have that case consultation and share files and scans, I can do that with my lab, who can actually talk to me, talk to my patient, and incorporate some of what we're working on together in a case presentation or treatment plan. So it really does that. I think what's nice is after a procedure might be done, I'll say old world might have been, and it's kind of current world too, might be a letter was written and mailed to the dental office. And now the doctor gets the letter a week and a half after the implant was placed, sees what was done, and now is able to call the patient and follow up. But with teledentistry and Teledent, there's a notification that goes that day. Procedure's done, GP's office finds out about it. They can call the patient, they can video conference the patient, they can message them to just know, we referred you, but we care about you. We're going to check in on you and make sure you're healing okay.
So we've talked a little bit, you and I, about, switching to the patient experience. We hear more and more these days in SOVR, patient engagement, patient engagement, patient engagement. So with teledentistry, with your solution in particular, as we move forward again to post-COVID, and I think more demands by patients to be part of their healthcare, right? That's in general now, right? Talk to me a little bit about the whole patient engagement part, where you see patients benefiting as we move forward with this technology?
Yeah, it's a great question. I think patients are hungry for the convenience that telehealth offers. So dental is different in that I can't have all kinds of appointments like I might be able to have with a psychologist or a counselor or a prescription, or some dermatology appointments can all happen virtually. But with dental, there are aspects that take time, they take chair time, they take PPE, they take dentist time, which can shift to virtual. So it may be a new patient consultation. It may be a limited evaluation that takes place after a preventive care visit. It may be post-op check-ins, right, or compliance checks. So a lot of those things that save a patient, for a dentist, it might be 15 minutes of chair time, but for the patient, it's an hour and a half of time off work. I've got to get my kid, I've got to bring my kid in, I've got to go back to work. That's not something that's going to foster a love of service when they come in and it's really like, yep, everything looks good. So that's the kind of stuff that we're trying to show practices. Look, your patients are looking for this. They're open to it. COVID has accelerated their willingness and adoption of the power of a virtual consult and the ability to communicate through that means. So I think that's the kind of thing that patients are really hungry for. Knowing that I could pull out my smartphone and ask my practice a question, whether it's about home care or a specific product, that really makes my dental provider a bigger part of my life at both of our convenience. It doesn't have to be phone calls. It just makes it that you're accessible to me. You're looking out for me. If I have an emergency or a concern, I have a more effective way to reach out to you. And you respect my time, and I can help you make more efficient use of your time as a provider.
So when we talk about adoption, I've been in technology, software technology for a lot of years, and adoption is always baby steps, right? So obviously, as you just pointed out, COVID kind of made a lot of practice groups and DSOs aware of the technology. But it's interesting because what I found with clients of mine when I've done software development for different customers in my past, you start with a concept that they can grasp. And then once you get the technology in there, they come back to you and they say, hey, you know what? I have another idea. Oh, I can use it this way. Wow, can you do this? Are you finding similar things that maybe teledentistry it was introduced in COVID? Some of your customers, now customers are coming back saying, hey, Brant, can you do this? This would help me. I was just kind of interested in that whole idea.
Yeah, I think as they've got it implemented and they've seen the opportunities beyond, that live 15-minute video consult while everyone was on their couch, I think they're seeing it used and kind of recognizing what happens when maybe it's not a tailored workflow for something, but they're saying, oh, well, instead of me referring to my hygienist to me or me to my periodontist, I have a sleep medicine doctor that I work with. I could invite them, right? My lab, I could invite them, and really start opening all of these different doors that the same platform offers to them. So I think that's really exciting. Of like, they get something on their head. Oh, I could use it for this. I could use it for this. We see people doing virtual study groups with it, right? They're inviting people who are in their collaborative study group. They used to go out to dinner. They can't go out to dinner now. So now they're doing it through this platform. So it is cool to see. And I think we do really encourage feedback from providers, because teledentistry keeps evolving. People keep learning from it. So we're really getting good feedback on approaches and use cases and how to implement it.
So you and I are in the dental industry, in dental technology, and we're seeing more and more dental practice groups and DSOs using teledentistry to reach out to the medical side, right? We know that's happening. I was very interested. I'm going to switch and put on my medical hat from my experience in medicine. Are you seeing physicians, general practitioners, specialists in medicine saying, hey, you know what, it wouldn't be a bad idea. On the flip side, I have telehealth. Everybody's telehealth in medicine, right? I'd like to reach out to a virtual dentist as well. Are you seeing that adoption as much on the medical side, or is that a higher bar right now?
So I think what's interesting, and maybe it shouldn't have surprised me, I think in the groups that were earlier to adopt that were more in the public health space. So maybe a community health center or an FQHC, they were already combining dental with medical. So their eyes were open to it, and they had the providers and the patients coming in for well visits or physicals and able to refer them to dental, or dental identifying an issue and an easier referral. I think we are seeing a lot more in group practices and DSOs and even private practices, whether it's for a marketing approach of saying, hey, I'm going to reach out to my local pediatrician. If I'm a pediatric dental practice and I give them an intraoral camera and I give them access to teledentistry, they can now refer patients over to me when they see something concerning. I think we're also seeing that expansion from some nurse practitioners, more dental popping up in kind of health and wellness centers. That's an area. And then we see more programs where that bigger goal of kind of value-based care, connecting patients to treatment earlier, is really encouraging patients to find that connection and find providers that offer that connection.
Yeah, I would definitely agree with you. You're right on, because when I was working, especially in the medical world, I had a lot of customers that was helping get software for FQHCs, community health centers, and they always had that dental medical side. And it was really interesting watching them work together. Of course, the challenge, right, was that dentists work one workflow and physicians work another way. So when you're looking for software, it's like, which one do we use? Which actually leads me to another question. Okay, so if you imagine a perfect world where I'm a dental group, dental practice, and I'm using Teledent to communicate with a cardiologist or a primary care physician. Yet, that primary care physician has been trained to use a certain telehealth solution that they're comfortable with, right? Can you see how they're never going to be integrated per se, but can you see how that workflow would work back and forth, given that you have two different telehealth solutions, how they can work in a collaborative effort? I was really interested in that whole idea.
Yeah, I think one thing we're, keeping our finger on the pulse of and moving toward is a lot of integration with kind of standards which are more established in medical EHRs than in dental, but using those standards to allow certain aspects of patient records to integrate between a medical EHR and a dental practice management system. I think we're also seeing ways that it may not have to be a full integration, but you might have access for, let's say, a medical provider in a clinic to pull up a tab within an EHR system, but load Teledent, that to connect them to the network of dentists or providers if there's a referral. So I think there is some flexibility in there. And I think that's where what's nice about a solution like ours that is tailored more to a dental practice workflow, as opposed to what is sometimes what telehealth is, of just always being a live video consult. is where there's a nice advantage that makes it time sensitive for providers. It makes it more convenient for patients, and allows better connection between them. I think we're also really seeing work that's bringing out, maybe it's a speech pathologist, maybe it's a nurse practitioner, maybe it's a oral myofunctional therapist, all of these different providers, sleep medicine, where they're seeing this as the tool that, while they had the drive for that kind of collaboration and seeing mouth connected to body, mouth part of overall health, now it was the missing link was having a platform to do that.
Yeah,
So
it's really
nice. It really
interesting.
opened those doors.
I'm sorry, but that's a great point, because we look for crossovers, right? Especially when I look at myself coming from medical, going into dental with different software technologies. I'm always looking for crossovers. And like you said, sleep medicine is a perfect crossover. I mean, I get calls from sleep medicine docs, physicians, and dentists, realizing the other side is just as important. Like, hey, is there a technology here that can cross the bridge? And
Right.
so sleep medicine, I think, is a really perfect example of where we're going to see that interoperability come in the future. You know, it's real interesting. You had mentioned interoperability of records. I don't hear that too much in dentistry. That's why I enjoy talking to you. The idea that, as you know, we do have a standard. There is a standard in medicine where medical records can, in different systems, can work with each other. We don't see that so much being talked about in dentistry. We do have that standard. So I'm hoping that as we build teledentistry more in the future, that the whole idea of that interoperability, that standard record that could be passed to a hospital, that we'll be able to see that, because that's so key, that interoperability of records, right?
Yeah, it's I think the long game. I think now there's more tools and technology. And look, to be frank, I've seen so many companies, even when it's medical record to medical record, there's a challenge integrating,
Sure.
right? And that's working with standard, physicians coding and ICD-10 coding. So I think there's a way to go for dental to do that. And I think there's also a misunderstanding in some ways of what medical coding could look like for a dental provider. A lot of providers we talk to think, that's for the oral surgeon when they're doing anesthesia and a more complex, reconstruction on a jaw or something like that. But there's a lot of touch points where this can come into play for dental providers. It also varies depending on settings where they might be seeing patients. There's care collaboration and referral from from a medical provider to a dentist. There's chances where if you're seeing a patient in a nursing home, it might be for medical necessity that a dental provider is brought in, and that's a referral from that medical provider to the dentist. So it's interesting. I think it's going to be fascinating to see how it evolves. And I think practices, maybe not the small solo practitioners, but I think groups, they're going to start to see these opportunities to really bring in what basic medical touch points could I incorporate into a dental care visit, right? Is there a way for me to add value to my patients and also pay better attention to their overall health?
Right. And, it's interesting you mention that, because what I found both in the medical world, technology, and the dental world is a lot of the innovations that we have in technology, sometimes they're adapted by the bigger groups or the practices, and, and then prices drop. And then when groups show that, hey, this can work, sometimes that filters down to the small practices. So a lot of the innovation sometimes is really put in the larger groups, and as you pointed out, and then it'll filter through the industry. So lastly, I want to kind of give you a little soapbox. And, people have heard of teledentistry, a lot of people, obviously with COVID, but if I'm a group, a practice, if I have a solo practice even, just in general, why should I be interested in at least looking into it? I know it's kind of a general tough question, but perk my interest a little bit as a viewer of this podcast. Why should I at least, I'm going to look into this stuff because it might help me in the future. So give me a couple of minutes on your thoughts on that.
Yeah, I think if we kind of walk down the path of maybe the easiest starting point of teledentistry all the way down to, these loftier goals of medical dental integration and that type of collaboration, I think one starting point is, can my website allow me to have a new patient intake form and provide a video consult that saves me time, saves my patient time, We could talk about cosmetic cases. We could talk about emergency cases. We could talk about ortho cases, right? Clear aligner, whatever it might be. That's a real place that rubber meets the road of here's new patients coming into my practice, and it's super convenient for me. The next level is how, once my patient has seen me, how do I communicate with them when they've left? So that follow-up, the case presentation, right? We talk about here, am I presenting a case with a mask on, with loops, with face shield, with full PPE? That's not as approachable anymore. So if you're presenting a big case to a patient, you might want to shift it to a video conference where you can talk to them, you could share your screen, you could show the photographs you took, and really walk them through what a case might look like. You can also make it really easy to send them an attachment of, we did an extraction today, here's your home care recommendations. Here, I'm going to send you a secure message, it's got a PDF, use that. If you have questions, reach out to us, right? I think that level of connectivity for a practice is key. And like I mentioned earlier, patients want that. They're expecting it and hoping to see that from their provider. You then get into internal workflow. I think then there's maybe the efficiency. So we're seeing a lot of the old world of kind of, my hygienist would see a patient, and wearing my lab coat, I would then go into the hygiene room. I'd change my gloves, I'd change my mask, I'd see the patient, and I would conduct the exam, and then I would go back to my crown prep or my other procedure in my other room, and I just put on new gloves, put on a new mask, and I'd see that patient. Now that process is a lot more involved and a lot more expensive, of changing PPE to go in for that limited or periodic exam, and then change my PPE to go back into my other maybe higher value case. So we're seeing practices, and we recommend, if you can do that limited exam or periodic exam in the evening and follow up with the patient through either messaging or a quick video call, that's going to save you time and allow your team more time to clean rooms, to see more patients. That's a real tangible benefit of teledentistry that we're seeing more and more now as so much infection control and in-office workflows have changed. Or messaging a patient who's in the parking lot and saying, I'm here. This is what you should do when you come in. And then I think...
I believe, Brant, that if people are interested, I know you're really big into education, and I believe on your site and other areas of people, because there's a lot of different benefits, right? That we could probably do a whole podcast on.
I could keep going, right?
I know, and that's why I love talking to you. Actually, in the sidebar, forgetting about the podcast, you and I talked for a long time. But I guess what I was going to ask you is, if people are interested, I know you've done a lot of materials. If they go to your website, is there a place they can find out more information on why is this good for me?
Yeah, you bet. Yeah, so they can come to mouthwatch.com. We have a 30-day free trial of Teledent, so you can get started with it, see what it's about, use it. We have a blog. We have a whole bunch of resources. We're happy to kind of help share with you everything from workflows and applications of it, all the way to how do I bill for a teledentistry encounter, or how should I conduct a teledentistry consultation. So we try to be a really good resource and educator on it, and we think you'll love our platform and give it a whirl.
Yeah, I'm really glad you mentioned workflows, because if anything, it goes back full circle, our initial conversation here, which is where is it going to be in the future? And really, teledentistry will be part of your dental workflow. And and you guys have done a lot of work on that, and you're doing technology supported. So I think that's just kind of a general 10,000 reviews. Your workflows will change for the better.
Yeah, well, and we're working on things like integrations into your practice management. We just rolled out Dentrix integration, so that the less clicks you're doing and the less of a lift for your team, the more easily it's going to be adopted into your practice.
Well, I do know from consulting, helping get both medical and dental providers software over a lot of years, the less clicks, the better, right? That's my mantra. That's what they told me forever, right? So listen, man, I want to get together with you again and see kind of, where you're going with everything, because you seem to be coming up with new things all the time. And I really appreciate you taking time out of your day to chat a little bit. And I look forward to talking to you in the future.
Yeah, same here. Thanks, Mike.